Hi there, everyone. Welcome to this lunchtime webinar. We'll just give everyone a minute. There's a fair few on already, but I'm just going to give it 30 more seconds to allow some people to join. And then once we're up to capacity, we'll start. So we'll just give it 30 seconds and then we'll be ready to go. Okay, let's get started, shall we? I hope everyone's got their coffees at the ready, and I'm going to take you through managing lower back pain, and we're going to look at some prevention and treatment strategies. So just as a quick introduction to myself, my name's Ashley James. I am the clinical lead of occupational health physiotherapy services for IPRS Health. As I said, I'm a physio. I've been a physio for the past 10 years. My predominant background is a little bit in the NHS private practice, but predominantly in professional sport with the Welsh Rugby Union. I was a physio with Wales Rugby for 6 years. And then in 2016, I moved on to become a clinical lead of physiotherapy for IPRS Health in occupational health. So working with people who are in job roles and on the coalface on sites and things. I'm also doing my PhD at the moment in occupational lower back pain and resilience. So specifically looking at how we can manage lower back pain in the workplace and how we can understand back pain a little bit better. So if we have any questions as we move through, there is a question box. You should all have a little side panel, and there's a question box on that side panel. So you can ask questions at any time, but I'll try and run through the presentation because there's quite a bit to get through, and then we'll pick up some questions at the end. But if you have any questions as we run through, just pop them in that question box as we run through. And then there's also Twitter at IPRS Health if you would like to ask any questions via social media, if that's easier for you. So what we're going to discuss today, we're going to look at types of back pain, and we're going to look at the three predominant different types. We're going to look at why we get back pain or pain more generally. We're going to look at, does the way you lift matter? Does the way you sit matter? And then we're going to look, using a case study, we're going to look at managing lower back pain and look at prevention and treatment options and what is best to do. So hopefully it should be kind of a conclusive whistle-stop tour of back pain in general. So types of lower back pain, and I'm sure there's a few of you out there that have had plenty of different diagnoses with regards to their lower back pain, but I just want to run through what the evidence is telling us at the moment. And the evidence tells us at the moment only 3 different types of back pain can be accurately diagnosed. So this is how the chart looks, and we have serious pathology, so serious issues that need immediate attention. We have nerve type pain, so things like symptomatic sciatica, spondylosis, stenosis there, and the rest of it really, which is about 90% of back pain. So if we look at those percentages, 1 to 2% is serious, and I doubt anyone on this call has got any of those. 8 to 10% accounts for true nerve pain, and 90% is what we would call mechanical lower back pain. But we can't really put our finger on a specific cause of pain, but pain is present nonetheless, and we're going to look at that a little bit more in more detail. It's likely that the majority of you on this call will fall into that 90%, and some of you will fall into that nerve type pain. So if we run through that, the serious stuff, 1 to 2% of back pain, what kind of symptoms would we be getting if we had serious worrisome back pain? We would have constant unremitting pain, pain that didn't change regardless what you did or what position you were in. Altered bladder and bowel function, sexual dysfunction. You'd be generally unwell, potentially, maybe signs of infection. You could have severe bilateral leg pain, so pain in both legs. You might find yourself being a bit more clumsy, tripping and falling, not quite having the control over your lower limbs as you did before. Severe night pain and night sweats. Now, it's important to say that actually any one of these on their own is still not to be too worried about. It's when there's a combination of things. When there's a couple of these things that start fitting into place, that's when we would start to want to manage this quite quickly. And when we look at management, A&E, imaging, and further specialist care, those are the things that we will be doing for this 1 to 2% of serious stuff. And any physio that you ever see, and I'm sure if some of you have seen physio already, you'll recognize some of these questions about maybe bladder and bowel function, night pain, things like that, with regards to back pain if you've been in for that before. So physios are very aware of this, as are GPs and other healthcare professionals, and it's generally something we rule out fairly quickly at the start of any consultation. And as I said, things like infection, cancers, something called cauda equina, which some of you may have heard, they're what we would consider the serious stuff. So the 8 to 10%, the nervy stuff, what would we be looking at there? So what symptoms would we get in? Sharp electric shock type pain, maybe hot, maybe cold, a burning sensation, some pins and needles and numbness maybe, and it would usually go down one leg into the foot. Maybe some weakness. Leg pain is often reported as worse than back pain. So you might get pain, you know, if you sit for prolonged periods, for example. Now, sometimes this can get mixed up in the 90%, and some people can think that they have sciatica, for example, or other nerve pain, when actually it's mechanical back pain. True nerve pain like this is quite distinct, and again, a physio in any consultation will be looking for these signs and symptoms to be able to rule in or rule out this stuff. Now, management-wise, this is interesting. So the initial management, even for this nervy stuff, is exercise and rehabilitation. The good thing about this is in 80% of cases, this pain will resolve on its own. So sometimes it can be caused by a little bit of a disc just touching on a nerve root, for example, that might cause sciatica. And in most cases, that nerve pain resolves because the disc goes back where it came from, and they're very good at resolving on their own. Injection therapy might be something you consider a bit further down the line, and if it's there for a while, then the last resort would be surgery. But what I would reiterate, and we're going to talk about this later down the line, if you have this type of pain, it's still safe to move. You know, we should be engaging with exercise and rehab and physio and trying to get on with our daily tasks. As uncomfortable as it is and as painful as it is, it's really important to note that you're still safe to move with this type of back pain. And that's things like sciatica, spondylosis, stenosis. Some of you on the call may have been diagnosed with some of these things before, but it's unlikely that it's the majority. So if we look at 90%, most of the stuff, mechanical back pain. Symptoms would be back pain worse than leg pain. So really, it can be severe or minor, and I think that comes a little bit later on. This type of pain can come on gradually over time, or suddenly after a certain movement or a twist or a turn or a lift. It can come on suddenly. Excuse me. Pain can be sharp or dull, so there's no real distinct type of pain for this. And it usually relates to movement or position, so we can either relieve the pain by getting into a certain position, or the pain increases when we get into a certain type of position. But that's why we call it mechanical pain, because when we move into certain positions, we can normally replicate the pain. Pain can be severe or minor. So, you know, even in really severe type back pain where it feels like you can't move, that's very likely most of the time mechanical back pain to a certain extent. And again, really safe to move with this and beneficial. And the reason we call it mechanical back pain and we don't give it a specific diagnosis related to maybe a joint or a ligament or a muscle is that it's pretty impossible on clinical examination, even in MRI scans, for example, to tell the difference. And this is why if you've been for an MRI scan, if you've been to your GP, for example, with this type of back pain, they're really reluctant to give you an MRI scan because it's likely not going to tell us any more than we can detect by clinical examination. The management for this, exercise and rehabilitation, is always the first port of call. Education, which is why you're all here now. Early return to work has been shown to be really beneficial for this. And more severe cases may need other therapy involvement. So chronic back pain, for example, that goes on for a while, and as we'll discuss a little bit further on, can have some other influencing factors like psychological elements, social elements, and things like CBT therapy can be really helpful for things like that. But mechanical lower back pain is what we would call most of the stuff, and it's probably what most of you have suffered with on this call. So why do we get pain? And we're going to go into just briefly into a little bit of this. And pain is always down to interacting factors. It's never just one thing. So if we imagine this dotted line at the top here is experiencing pain, it's having a painful experience. What we can do is, if we put these up, you can see any one of these things on its own is not enough to get you over that threshold. What it is and what pain tends to be is a combination of things that stack on top of each other that eventually maybe tip us over the edge. That's why, you might find yourself in work doing a task that you've done 1,000 times and you've never experienced pain before, but this day it seems to be aggravating something. It seems to be a little bit niggly. It's likely that physical load plays a part in that. So the position that you're in and the stress that you're putting on the muscles and the ligaments and the tendons and things will play a part, but also stress will, or sleep will, past experiences of pain will, low job autonomy. If you can't change your job easily, that can all influence in you experiencing a little bit more pain. So it's always about these interacting factors. And what we refer to in physiotherapy is this biopsychosocial model. So if I put these up on the screen for you, the biological things are the bones, the discs, the ligaments, the muscles, and the cartilage. So the physical things that can influence pain and make us experience pain. Psychological things are fear of movement. So, past experience, if you've had a really bad past experience of back pain that was really painful and it hurt when you move, that may, if you experience it again, it might make you more fearful of movement because you're thinking about that it hurt last time and it didn't quite, and it took a while to go. Expectations of what will hurt, beliefs about pain, and flexibility of thought. Social things like support from family, support in work, social isolation, interaction with others, and workplace culture can also play a part in how you experience pain. And everyone is different. So everyone's bubble will be of different size. If we look at these three, and the first one, biological thing, is a bit bigger. The second one, the psychological, and the third, the social. Everyone will have a bubble that is slightly bigger, that's influenced in their painful experience. But it all plays a part always. In every painful experience that we have, these things are always in play. It's never just one thing that contributes towards our painful experience. It's a bit like eating food. So if we just had our taste buds, the experience of taste wouldn't be the same and may even not exist if we didn't have smell, touch, sight, past experiences of eating that food, the context of where you are in the world. Where are you eating it? Is it a nice restaurant? Is it off a market stall? Where we do these things make a difference as well. So if you liken pain to how we taste food, that can be quite a good analogy. It's an experience. When we go out to eat food, we talk about a dining experience, and that contributes towards the taste of the food. Pain is very much the same. It's contributed to by lots of different things, and they all matter. I'm just going to go into a couple of different research things here just to give you an idea. So this was a great paper done in 2006, and what they did was they took a group of 200 people who had never experienced pain before in their life. They'd never experienced pain and they'd never had back pain, and they MRI scanned all of them. And then what they did is they followed them over 5 years, and when they did experience back pain, so when that group of 200 people, a proportion of them had back pain at some point in the next 5 years, when they got back pain, they re-MRI scanned them to see what was different. And in 84% of cases, they found nothing new, or things had gotten a little bit better from how they looked in the first MRI scan. So you can see there how people can have severe lower back pain, but on MRI scan, there's no new findings. So that's what we would term the mechanical back pain. We can't quite put our finger on the origin of pain, but pain exists nonetheless. And that doesn't mean that pain isn't real or it isn't there. It just means that there's other factors that are contributing to that experience of pain. This is another great diagram. I know there's a lot on there, and I'll just talk you through it briefly. So the important thing to note is that these percentages are in asymptomatic patients, and what that means is people in no pain whatsoever. So if we go right down the middle, for example, and look at age 50, in this study, which was done over a lot of people, so a really broad range of people, so it's really generalizable to the wider population. In 80% of those people, they found disc degeneration in 50-year-olds. 60% of them had a disc bulge, but were still in no pain whatsoever. 36% had a disc protrusion, still no pain. So these things are really common, and they get more common as we age. So just as when you look in the mirror now and you look in the mirror in 10 years' time, you will notice a difference. Things will change. There'll be new wrinkles, a few grey hairs maybe, but that doesn't mean that that necessarily has to be painful. Wrinkles and grey hair certainly aren't painful. And the way we age on the inside is no different. Things change, but they don't necessarily always mean that they're going to be painful. And I want to talk a little bit about the relationship between pain and damage here before we go on to the management of things. So if I press click here, we see a green and a red line, and pain is the red line, physical damage is the green line. And what we can see at the start of any injury, pain and damage are much more closely related. They're much more matched. So I know we're talking about back pain here, but if we think of an easier example like an ankle sprain, you know, it's quite obvious when initially when you go over on your ankle on a curb, there is tissue damage there and there's pain there as well. Damage and pain are much more matched. So in back pain, if you lift something suddenly, for example, it may be that there's a muscle pull or a ligament strain in one of those areas around your back. But quite quickly, what we see is that tissue damage heals, and we know fractured bones, for example, only take 6 weeks to heal. So that doesn't account for why people have back pain 12, 18, 20 weeks after their initial injury. And what we're interested in is this gap in between the two. And this is where those psychosocial factors come in. So thoughts, behaviors, sleep patterns, stress levels, current situations, beliefs, all of these play a part in how someone experiences pain. And if we're having really negative thoughts about back pain, if behaviorally we've reduced all activity, we're off work, we're not exercising anymore, those are going to have negative effects on your experience of pain and make pain last for longer. And what we can work to do in rehab is to get rid of some of these things so that pain follows the physical damage a little bit more closely and we recover as normally or as we would in the time frame that tissue healing exists. So what can happen sometimes with back pain, and happens a lot actually, is quite often pain is an alarm system. That's all it is. Pain is an indication that something might be wrong. Not that it is wrong, but that something might be wrong or damaged. And quite often what we have is that alarm going off for a burnt piece of toast rather than a house fire. Pain is going off because it detects something that might be dangerous, and the alarm goes off all the same, regardless of what actually is there. So in summary, and the important point there is pain does not always equal damage, and damage does not always equal pain. Really important messages, because when we have back pain, if we think that pain equals damage, it might make us not move. It might make us stay inside. It might make us take more time off work than we actually need because we're afraid of making more damage or causing more damage. And what we know in 90% of cases is that doesn't happen, and movement is a positive thing. So let's look at, we're just going to briefly touch on another thing, on another few things, because I want some time to talk and field questions at the end if anyone has any. So does the way I sit matter? You know, we hear this a lot. just as a little quiz, just have 5 seconds to consider these options. So which of these has the weakest link to back pain? So which is the least associated with back pain? I'm sure we've all got an answer in mind. The answer is actually posture. So we hear a lot about posture, and we feel like it's really important for back pain and neck pain and things, that the way we sit is really important. We must sit up with our spine straight really rigidly. And that's not actually the case. Posture is really weakly associated with back pain. It doesn't seem to have that much of an influence. And I think you can see that if you look around your workplace, wherever you are now, there'll be people that have what we would consider maybe bad posture, but are in no pain whatsoever. What is important with posture is how often we're changing position. So any one position sustained for too long is not a good thing. So if you think about soldiers standing on guard, they are in what we would consider a perfect posture. But I'm sure if you spoke to any of those guys after 15, 20 minutes, they would want to move, they would be uncomfortable. So there's nothing wrong with slouching. There's nothing wrong with sitting up straight. There's nothing wrong with anything in between. The key thing is we're moving fairly regularly. For me, your next posture is your best posture. And that's what would reflect in all of the research that's done as well. So what is important is that you're comfortable. The same as when if you're buying shoes, if you're thinking about an office chair, be led by comfort. What are you most comfortable with? And that is likely going to give you the least amount of pain. Spine position plays much less of a part. Does the way I lift matter? Again, we all go through this every year pretty much in work. So does the way you lift really matter? Let's look at some of what the science says. So what is currently taught? Lift with a neutral spine. So what we know is even when you're attempting to maintain a neutral spine, it still flexes quite a bit. And actually, if you look at the HSE guidelines, they actually advocate a slight bit of spinal flexion at the start of a lift. There's nothing wrong with bending your spine a little bit when you lift. It's perfectly safe to do. So increase pressure on the disc when you bend your back. So that's one of the things that's currently taught, is that we're really putting pressure on our discs. And actually, when we look at the evidence, there's no significant difference. There's about a 4% difference between when we squat lift and when we stoop lift, which isn't really that much or that significant. Constantly bending for me will be bad in the long run. So there's some really great research actually done that looks at those who've performed thousands of bends over and over and over again and compares them to those who haven't. And lower back pain rate is the same. So it's not that you won't get back pain again in the future. Back pain is really common. 80% of us will have back pain at some point in our lives. It's likely that we will have it in the future, but it won't be because of that you've bent over at some point. So what would the best advice on lifting be? So if we go from light to heavy, if we're thinking about light things and lifting light things up, it really doesn't matter how you lift or how many times you do it. You do it however feels most comfortable for you. Again, be led by comfort, be led by what you're used to. If you are lifting 25 kilograms plus, or you're lifting over 25 times a day on a regular basis in work, this is when the risk of back pain increases by about 3 to 4%. So in these instances, we want to be avoiding end of range. So there's nothing wrong with, there's nothing wrong with a bit of spine flexion, but avoiding doubling over and bending right over, which I doubt any of us do, is a good thing to do. Use moderate to low speed. So taking our time a little bit more, being a little bit more thoughtful, and keeping objects closer to the body. There's some good evidence for that. So avoid end of range, use slower speeds, and keep objects closer to the body. That's really sound advice for if you're lifting 25 kilograms plus or over 25 times a day. It's also important to consider these if we're new to a role, returning from injury, we're lifting an unaccustomed load in an unaccustomed position. And we'll talk about capacity a little bit more in a minute. We also need to consider everything else: sleep, mood, past injury, beliefs. These things all play a part in how we lift and our experience of pain after we've lifted. So that it's really to consider, rather than just I must keep my back straight. It's important to broaden our understanding on this so we can give ourselves the best chance. So essentially, like I said, a little bit of bending over is not bad at all. We shouldn't be fearful of it. And actually, there's some really good evidence that lifting is excellent for our discs. It's excellent for our spine. It's just like any other part of our body. It responds to load. So bones get denser, muscles get stronger, ligaments get more taut. So lifting is not necessarily a bad thing. And promote ongoing movement variability. So there's some good evidence to suggest that moving in lots of different ways is really beneficial for us. So having the ability to move in lots of different ways safely and not the same way all the time gives us more movement options. So practicing moving in lots of different ways is a good tip. So let's talk a little bit more about capacity. I've just had a question, so I'll just check what it is before we move on in case it's super relevant. I can't see it. I'll go back at the end. Okay, so capacity. So if you imagine this circle is your capacity to complete your usual tasks. And if we keep the tasks within your capacity, it's very unlikely that we're going to get injured because we're able to cope with all of the load that happens around us. So if we increase our load too quickly, this is what happens. Tasks start to fall outside of our capacity, and this is when we're at risk of back pain. So if we're at work and we've changed job, or a role's changed, or outside of work you've started doing more exercise, it's not that any of those things are inherently bad. There's very, very few movements, if any, that are bad for us just on their own. What's bad is doing them too quickly before our capacity has had a chance to catch up. So if we increase our loads or our demands too quickly, things can start to fall outside of our capacity, and this is when we're at risk of back pain. Similarly, if you go for long periods without doing any exercise or inactivity, our tasks might not get bigger, but our circle shrinks a little bit because our capacity is not as big because we haven't been doing our usual activities. So if you've had time off work, if you've had time off sport, for example, and then you go back to work or back to sport, this is when you can be at risk a little bit if you haven't done enough rehab because your capacity is smaller. So if you've been off work with back pain for a little bit, then it's a good idea to get some rehab and training in before you go to grow that circle. Make sure that when you get back into work, all of your demands fall within your circle of capacity. And that's what this illustrates. So if you engage with prolonged rehab or exercise, your circle gets bigger, and that gives you a little bit more wiggle room, a little bit more robustness, that if those tasks do increase suddenly, you've got the capacity to cope with them. Similarly, if you do go through a little bit of inactivity because you're off work and that circle grows, you can still have capacity to function relatively well because your circle was bigger to start with. I hope that makes sense. So let's look at managing lower back pain. And we've been going for half an hour now. This should take 10-15, and then we'll have a good amount of time for questions. So let's look at a case study. So we're going to look at an acute, non-specific mechanical lower back pain. I don't know why I've written lower back pain twice. So we have a 50-year-old male. So I'm going to talk through each point and what that means for management. So 50-year-old male. What we know from the middle of that graph is that he's likely going to have some degenerative changes. He's likely going to maybe even have a disc prolapse or a disc bulge, but that doesn't mean that's the cause of his lower back pain, particularly if he's got no symptoms that are in the nerve category. So if he doesn't have that sharp, burning, hot, cold, pins and needles numbness pain down the back of his leg into his foot, the classic nerve presentation, it's actually very unlikely that any of those things play a part. So if this patient was to come to me with a scan and he said, oh, I've got disc degeneration, I've got a disc bulge, but he had acute mechanical lower back pain symptoms, this is the conversation that I've been having, that likely those things that you can see on the scan are incidental and just natural age-related changes like his grey goatee. They are likely just natural changes over time rather than being the cause of his pain. So he's had a gradual onset over the last week. He's had previous lower back pain over the last 10 years, which has come and gone. So that to me immediately says he's going to have some preconceived ideas and beliefs about what back pain is. He may even have some really good strategies himself that he's developed that help him cope with his lower back pain. He works shifts, so I know his sleep pattern is going to be affected, and that's something I'd like to develop an understanding of in my consultation. He's a smoker. He's recently moved jobs that involves more lifting, so immediately I'm thinking, okay, his capacity bubble may have stayed the same, but the tasks have increased. So are things just creeping out of his capacity a little bit? He believes his lower back is badly damaged. So what we know is that the damage and pain are quite closely linked at the start of an injury, but as an injury creeps on, those things get further apart. So I'd be having a conversation around educating him that back pain doesn't always mean that it's badly damaged, and he is safe to move. Lower exercise levels outside of work, and he's getting married in the next 3 months. So there's potentially there some personal stress, maybe some financial stress, but there's certainly going to be a heightened sense of stress potentially with this gent. So that could also be influencing the level of lower back pain that he's experiencing. But as you can see from this kind of overview, we're really looking a little bit more broadly about the management of this than just looking at his lower back. So what would I do to add to his recovery? And we'll look at short term and long term. So in the short term, I'd be looking to maybe temporarily modify his workload, bring his tasks inside that capacity bubble for him. So we can temporarily modify his workload so he's not working as hard. We'll be encouraging him to move often and in a relaxed way. And that could be generally if it's relatively minor pain, or if it's more severe, then I'd be giving him some specific exercises potentially to follow. We'll be taking steps to improve his sleep in the short term, and also looking at options to manage his stress or anxiety if he's feeling any. In the medium term, we'd be looking to improve his level of movement variability. We'd be talking about lowering his alcohol intake. We'd be talking to him about exercising regularly. So the advised dosage is 150 minutes per week of moderate intensity exercise, or 75 minutes per week of high intensity exercise. And if you're unsure about which tasks fall into those categories, the NHS website is really good for that. It gives some great examples of what is moderate exercise, what is high level exercise. So if you're unsure, I definitely recommend visiting the NHS website. Just type in exercise and it will take you to the right place. We'd also be looking to increase his training so he has adequate strength for his required tasks. If he's moved into a new job role that requires more lifting, we'd be looking at increasing his bubble, making his capacity a little bit bigger so he could cope with those demands. And in the long term, we'd be talking about smoking cessation and maybe about diet and nutrition to try and help him lose a little bit of weight, because we know that negatively influences back pain. You can see there's a short term to long term kind of plan that I would put into place, and these are the types of things that we'd be doing to help his recovery. And just reflect over this list now and think, if you've had back pain before, are these the types of things that you've been doing? If not, are they things that you could consider in the future? Because these, we know from evidence, are the things that help. So when we're looking at a treatment pyramid, so this is kind of the things at the bottom are the things we definitely should be doing, and it gets less and less as we kind of creep towards the top. So movement, exercise, returning to usual tasks. If you have back pain, this is the fundamental thing that we should be doing. We should be looking to encourage movement as much as possible and return to usual tasks as soon as possible. And that's not to say you should do it if you're in excruciating pain. It's all about taking our time and making sure we do it safely. But movement and exercise are very safe to do and are fundamental to any recovery from lower back pain. Secondly, specific rehab from a healthcare professional. So getting some specific exercises can be really helpful, particularly if the pain's quite severe. Modifying work tasks to reduce load, as we've talked about, that can potentially be helpful if work tasks are playing a role. Other lifestyle factors, so we're thinking about smoking, weight, sleep, we're just thinking about general stress and anxiety and things like that. Are there other things that we can address? And then lastly at the top is other stuff, and this might surprise you, but things like acupuncture, massage, manipulations, bracing can be, or I've usually been, people's go-to kinds of things. And I'm not saying don't do any of these things, but if you're not doing everything else under that in the pyramid, it's very unlikely that it's going to have much of an effect on your back pain. So they're okay to do, but what I would say is make sure you're doing everything else underneath that first before you try any of those things for the biggest effect. Again, when we're thinking about prevention, so if we've had back pain, that was the treatment pyramid, now the prevention pyramid. So if we're trying to prevent back pain, what are the things we should be looking to do? There'll be some of you on the call now that maybe don't have back pain at the moment and are just looking for prevention tips. So being generally in good health, having good sleep and good management of other stresses is the fundamental place to start. So making sure we're exercising regularly, we're sleeping 6 to 8 hours at least, good management of other stresses, and managing any mental health issues that may be there, depression, anxiety, they're fundamental. Regular engagement in physical activity, as I've said, getting that 150 minutes or 75 minutes in a week really goes a long way to preventing any lower back pain. Making sure that our capacity bubble is big enough, so we have adequate strength, and it says strength, but it could be flexibility, movement ability, endurance, but making sure that our abilities match the tasks that we need to do, and having adequate strength for that is really important. Good movement variability, as we've talked about, so having the ability to move in lots of different ways is very good for prevention. The more movement options we have, the body is kind of never surprised when it gets into a certain position because we're used to moving in lots of different ways. And then again, other stuff, realignment, adjustments, core stability, any special clothing, braces, tape, massage manipulations are very much things that you can do. But if you're not doing everything under that pyramid, then it's very unlikely that any of those things are going to play a big part in prevention of lower back pain. Best exercises. So I've put an example of 4 up here just to watch. And this is for an acute mechanical lower back pain. So we're just looking to work generally through range of movement. We're looking to try and relax, and we're trying to gain as much movement back as we can. Now, the important thing to note about exercises and back pain is actually there's no one exercise that's better than another, particularly for prevention. So if you don't enjoy weightlifting, then don't do weightlifting. If you enjoy swimming, do that. If you enjoy yoga, do that. Even walking has some really good evidence for reducing the experience of lower back pain. So there's no one exercise that's better than another, and there's certainly no one exercise that we should fear more than any other. So no exercise is off limits. And what I would say is it's how you get there, which we're going to talk about in a minute. So graded activity, and this is what I was talking about. So what we want to be mindful of whenever we're doing any kind of activity at work or at home is how quickly we're increasing those activities. And we talked about not increasing the tasks within your bubble too quickly. So for example, if we're, and I've used weightlifting here, but it can be any activity. So if we think here that we've got this lady here who's doing some light weights, if all of a sudden she decides to go really heavy with those weights, that's when we're going to have an increased risk of injury. When you spike your load and do too much too soon, things start to fall outside of your capacity, and that's when it's likely that you're going to get some back pain. When what we want to do actually is over time is just gradually increase our ability to do those things, so we can get to the same place. There's no real limitations in what we can achieve in terms of movement or strength. It's how we get there that's important. And when we're thinking about back pain, increasing those tasks too quickly is one of the biggest influences on how you get back pain. So in summary, before we take some questions for 15-20 minutes, is back pain is really common. 80% of people have it at some point in their lives. In 98% of cases, you are safe to move despite pain. I know it can be uncomfortable and I know it's horrible. I've had back pain myself, but it's really important that we do move as soon as possible. Most back pain will resolve on its own. Even the nerve type pain, most back pain resolves in 6 to 8 weeks. Movement and exercises are the best forms of prevention and rehabilitation that we have. No one exercise is better than another, so pick something that you enjoy and you know you can stick to. Try not to increase or decrease things too quickly in your life if it can be helped. Don't overly worry about posture, the way you sit or the way you lift. Pick a way that's comfortable for you and that you're used to, and go for that. There's lots of other things that can contribute towards pain, so be mindful of stress, anxiety in your relationships at home and at work. If those are not great or something changes within them, then that can influence why you have back pain. So if for some reason you're having back pain, then really try and think broadly about what potentially could be contributing towards that. So I hope that was helpful. And now we've got a bit of time to field some questions if we have. I'll just have a look at some of the questions. Okay. Okay, so less alcohol equals better sleep and less calories, I guess. Yeah, that's true. Alcohol people say, you know, sometimes they take alcohol before bed to help them sleep, but it's a false kind of sleep. We don't have the same kind of sleep that we do when we don't drink. So it's better to not drink and, like you say, less calories. Do we have any more questions? There's a rather long one here from Michael, I think it is, but it goes into quite a bit of detail regarding what he's had done so far. So I don't want to read it out. Arthritis impacts. Yeah, arthritis certainly can, and there's different types of arthritis. So there's osteoarthritis, which is bones, and that is similar to knees and things, and that can influence pain. But again, it can be a natural age-related change. If we scanned all of our bodies, I'm sure we would all have arthritis in a joint, but it doesn't necessarily mean that it's going to be painful. It's not destiny, but certainly it can. And in terms of management, things don't change. So if we think of knee osteoarthritis, spine osteoarthritis, shoulder osteoarthritis, the best thing for that is exercise and movement, and that's the best way to manage it. So the management doesn't really change. Okay. I run regularly. Does it make a difference if I run? Sorry, the questions are coming in thick and fast now. Does it make a difference if I run on machines or road or forest tracks? Not particularly, Leslie. I mean, it might in terms of the terrain, so it might have an influence on ankle stability, for example, or, you know, if and again, if you go from something that you're used to something that you're not used to, that can play a part because the body is stressed in a different way. If you're used to running on all those different terrains, then it won't make much of a difference for back pain. And what is more likely to play a difference is how much you run, so the volume of running that you're doing. If you increase that too quickly or decrease it, that's likely to play a part, but the surface plays less of a part. Should I use a belt when weightlifting? Good question, James. That's something I hear quite often. The answer is you can. It's certainly not detrimental, but there's no evidence to suggest that it's helpful either. So there's really good studies that show when you lift with a belt and when you lift without a belt, the activity in your trunk muscles is pretty much the same. So you don't brace any more or less when you're wearing a belt. So if you're comfortable using it, then use it, but it's certainly not something that you have to, and it certainly doesn't strengthen your spine. Your spine is extremely, extremely robust and strong. and weightlifting is very good for it. So it's certainly something that you should worry about too much. Any advice for comfort for back when driving in the car for a long time and regularly? Hi, Karen. Yeah, so this is again something that I hear quite often. I work with drivers, long haul drivers. There's no magic kind of exercise or magic maneuver that we can do, unfortunately. The best thing is to move often and move regularly, which isn't easy in the car, I know, but being as comfortable as possible. Sometimes taking a hot water bottle, particularly just to ease, just as a little bit of a distraction, that can help. But I would advise a break at least every 2 hours if you're driving. So getting up out of the car, moving about. So we're looking at every 2 hours. Are standing up desks better than sitting down desks? That's a very good question for work. It's a good question, and the evidence isn't conclusive at the moment. So essentially what we're doing is replacing one sedentary behavior with another. So whether we sit all day or whether we stand all day seem to create kind of the same problems. We're inactive doing both. We don't burn many more calories if we're standing compared to when we're sitting. And if you're sitting, there is some evidence to suggest that you get back pain a little bit more often than if you stand. But if you stand all day, you tend to get knee, ankle, and lower leg pain a little bit more than you do if you sit all day. So it's a toss-up, really. The best thing to do, actually, is if you can have a sit-to-stand desk and you can change your position every hour or so, maybe, then that's probably the way to go. So that variation in movement, again, is something that you should probably look to do rather than staying in one position all day, whether that's sitting or standing. Very tight, limited range of movement in my hamstrings will improve in this ease back pain. So there's no real evidence to suggest that hamstring tightness influences lower back pain. So there's people with really, really tight hamstrings that have no back pain, and people with really loose hamstrings that have quite bad back pain. The hamstring length doesn't really influence back pain. It's likely that if you stretch hamstrings more or moved a little bit more often, that will help back pain and improving your mobility in general. We talked about that movement variability, like we say, the ability to move in lots of different ways. If you improve that by improving hamstring length, there's a potential that will influence, but certainly just having short hamstrings doesn't influence lower back pain. Better to sleep on my back or on the side and a hard mattress? Again, a real common question. And the answer is pretty much similar to when I was talking about how we sit. Be led by comfort. Some people prefer a hard mattress, some people prefer a soft mattress, some people prefer to sleep on the side, some people prefer to sleep on their back. There's no evidence to suggest that any sleeping position is better than another or any mattress is better than any other. The problem is there's pretty big industries built on ergonomic beds and temper mattresses and things, and so there's a lot pushed in the advertising world and the media, but there's certainly no hard scientific evidence that one's better than another. The best thing to do is sleep in a position that is comfortable for you. Sleep is one of the most important things we can do, and if you're not sleeping, that will influence back pain. So if you can sleep, I'm not too bothered whether you do it on the roof of your house. If you sleep, it's good for your back. So sleep as any way is comfortable for you. So there's a question here about ankylosing spondylitis, and that is a rheumatoid arthritis condition, and I'll touch on it because we mentioned osteoarthritis before, and the other type of arthritis is rheumatoid arthritis, which is an issue that is kind of manifests in the blood, and you can get it diagnosed by a blood test. It's very different to osteoarthritis, and ankylosing spondylitis is one of those rheumatoid arthritis problems. So this report is constant low and upper back pain, weekly physio and acupuncture, trying to exercise in the cross trainer, but it appears to be aggravating the situation. What do you recommend? So as I'm sure you're aware with these things, they do go through periods where they flare up a little bit, and then they settle down. They kind of go through these kind of peaks and troughs. I would suggest, I'm sure you are, but having the right medication from your GP and or specialist is number one. And making sure exercising regularly is a very good thing to do. But even if it's aggravating and even if it's a bit sore, you're doing the right thing by exercising. Maybe just play around with how much you're exercising. Do a little bit less, so it might aggravate a little bit less, and see where you go from there. Find out where that line is for you that it starts to aggravate, and maybe just stay a little bit under that. What I would encourage you to do is not stop. So please don't think, oh, this is aggravating it, I'll stop doing that, because that's when it might start to get a little bit worse. Movement is definitely the right thing, and you're doing the right thing. Just maybe play around with how much you're doing and work with your physio there and they can help guide you to how much you do. Is there a way to maintain loose back joints over a long term? Yeah, so there's plenty of exercises out there, and like I say, there's no one exercise that is better than another. So if you like squash, if you like swimming, if you like weightlifting, all of those things are good. And anything that promotes movement variability, where you're moving in lots of different ways, is a good way to keep loose back joints. I mean, joints don't really get loose. And the same thing happens with muscles when they get more flexible. What happens is your nervous system relaxes a little bit, because it's your nervous system that stops joints going towards their end of range. So if you're doing that a little bit more often, it kind of reassures the nervous system that it's safe to do. And the joint doesn't get looser, the joints remain really strong and robust, but the nervous system relaxes a little bit and allows for that movement. So going towards the end of range more often can be a good thing in a nice controlled way. So things like yoga is probably good for that. But if you don't like yoga, then it's a pointless treatment. So do something that you enjoy. Do you have recommendations on how to avoid osteoporosis in the spine? Okay, so osteoporosis is a disorder where the bones are a little bit weaker than usual. You're usually diagnosed with osteoporosis fairly early on. So if you haven't got osteoporosis now, don't worry about developing it over time. The best thing for osteoporosis, and they do this as a treatment now, is weightlifting. So weightlifting increases bone density. So lifting things that are heavy helps to increase bone density. So weightlifting is a really good option to avoid osteoporosis. And I know that might sound counterintuitive and it might seem dangerous, but if you do it under guidance of a good physio or a really good strength and conditioning coach, then weightlifting is very good for the prevention of osteoporosis. Few more questions, I think. My neck clicks at times when I slowly move my head left as I exercise. Is this normal? Very good question, and I'm glad clicking came up. So it's really common. Clicks and cracks are really common. The time you should worry about clicking is if it starts after trauma. So if you've been in a car crash, for example, if you've fallen, if you've been in a rugby tackle, if you've been doing anything that means you've been hit or jolted about. If clicking develops after that and it's painful, then it's worth getting looked at. If, for example, it's kind of come out of nowhere and when it clicks, the joint feels a little bit looser and there's no pain, that is nothing to worry about whatsoever. So what clicking is air gets into the joint space and mainly nitrogen gas, but we don't need to go into it. So air gets into the joint space, and a bit like bubble wrap, when you press bubble wrap, air escapes very quickly from a small space and it makes a clicking noise. The same happens with your joints. So air gets into the joint space, we kind of close down our joints a little bit by turning our neck or twisting our back, and that closing of the joint space means that air leaves very quickly. And that just makes a clicking noise. That's it. It doesn't lead to arthritis. It doesn't cause any damage. It's just a noise that occurs because air is leaving a joint space. That's why the joint might feel a little bit looser, because the air isn't there anymore. And that's why when you do it again in a few minutes, it occurs again, because that joint space is filled up with air again. But it's certainly nothing to worry about. I hope that answers your question. And one last one, I think. I've got one last question on here, and I'll go back to make sure I haven't missed any. Is there any evidence that joint supplements help in the long term? Okay, so again, a good question. And if we think about that pyramid that was in the presentation, so if we think about our treatment pyramid, supplements would be at the top of that pyramid. And there's things underneath that, like regular exercise, good nutritious diet, regular engagement in physical activity. You know, those things would be under the supplements at the top. Supplements are exactly that. They're to supplement your usual everyday stuff. So if you're exercising regularly, getting enough sun, you're eating a nutritious diet, and you still feel like you want to take some supplements for joints, then go ahead. There's no long-term evidence that it's massively effective because of all the other variables that go into it, because it's really hard to research the evidence over a long period of time, because anyone that's in the research will be doing lots of other things as well. So there's no real good evidence that joint supplements help in the long term. But what I would say is, if you're not getting enough sun, not exercising regularly, and not really eating a great diet, then joint supplements are likely not going to do much at all. I hope that answers your question there. I'm just going to go back 1 or 2 pillows. Again, just to go back to the bed discussion that we had, whatever's comfortable for you. Whatever's comfortable for you. Don't let advertisements scare you into needing 3 or 4 or 1, or a special one that costs £300 million. I'm just looking through old questions. Do the recommendations work the same for neck pain, as this discussion was mostly around lower back? Yes, Lee. So apologies for that, but yeah. So neck pain has 3 very, very similar groups as back pain. There's mechanical neck pain, which is 90% of things. The nerve type pain, which means you can get pain in your shoulders, down your arms, into your hand, which would follow the same symptoms. And serious pathology, but the difference is there. You wouldn't be getting bladder and bowel dysfunction. You might get things like dizziness, severe headaches that don't respond to medication and are there for a long time, fainting, double vision, trouble swallowing, trouble speaking. You would get more serious signs like that. There's a different set of questions we ask for that, but the premise is very much the same. So mechanical neck pain, the best thing for it is exercise, movement, and you can get some really good exercises from a physio for that. But again, the categories are very similar. Is the material I've used available? So I think what you get after this is an email with a link to the recording of this, so you'll be able to go back and watch the recording again. So in that way you can get the material. And one last question with 2 minutes to go. Diet and weight loss should also help. Yeah, so having a nutritious diet is good from a nutrition point of view, so you get the right vitamins, minerals, and our nervous system, our bones and our muscles get the energy that they need to function properly. That's one reason. But yes, weight also does play a part. So the higher your BMI, the more likely you are to develop back pain. But it's also more likely that you're not engaging in regular physical activity if you have a higher BMI as well. So if you engage with regular exercise, that should start to alleviate the back pain problem, and then the weight loss can follow that. What are the best things to eat to help back problems? Nothing specific, nothing other than a general good diet. Can't say that there's anything specific that is just good for back pain. Having a general good diet as per nutrition guidelines is something that we should aim for, and that will have a knock-on effect to back pain. Okay, well, thank you very much. Thank you very much, everyone, for listening. I hope that's been helpful. Any questions? My email is ashley.james@iprsgroup.com. That's ashley.james, ASHLEY, .james@iprsgroup.com. If anyone has any questions, feel free to send them through. You'll get an email with the recording of this, I think, and also there's a link to a short feedback survey that should take 5 minutes to fill in. So I'd be really appreciative if anyone could fill it in, because we want these to get better and better for everyone who's taking part. So hopefully this has been helpful, but ones in the future we want to make even more helpful. So your feedback is really vital to that. So if you could do that, that'll be with you in the next hour or so. So if you get a chance this afternoon or tomorrow, then just let me know. Thanks very much, everyone, and have a great rest of the day.